Okay, so hello everybody. My name is Mariam Abdul Muqtadir. I am a second year medical student, and today I will be talking to you guys about your last two lectures, vitamins 1 and 2. Now, before we get started, I want to preface this by saying that these two lectures are very important. Don't think that just because they came at the end, they're not going to be there's not going to be that many questions. From my experience, we had like 5 or 6 questions from these two lectures on the exam. Okay, with that, what are we going to be talking about today? We're going to be doing like a short introduction, then going into water-soluble vitamins, and then fat-soluble vitamins. It's not that complicated, there's just a lot to know. Speaking of things you need to know, the stuff in red is really, really important. So if there's one thing you take away from this PAL session, let it be the things that are in red. But if it's in blue, don't worry about it. It's mostly like mnemonics and things that will help you remember. If it makes sense to you, that's great. If it doesn't, ignore it. So, our introduction. What are vitamins? Basically, they're micronutrients. You need them in small amounts and they're organic. If you have too few of them, that's a deficiency and that's bad. But if you have too many, that's also bad because it means it's being toxic. So, water-soluble vitamins. These vitamins are not stored in the body and they work as coenzymes. If you have too many of them, they are excreted in the urine. So you don't have to worry about toxicity, except for B12 and folate because they are stored and they're stored in the liver. But what if you have too little? Then that's a deficiency. And deficiencies are very, very important in this lecture. Then, what are these water soluble vitamins? Basically, the B complex, which is a bunch of vitamin Bs, and vitamin C. So, before we go on though, there's something very important that you need to know, which is the TLCFN enzymes. I don't know if you guys have heard about this mnemonic before. I'm pretty sure you have, but it's the lovely coenzymes for nerds. The reason why you need to know these three enzymes and their coenzymes is because a lot of vitamins are precursors for these things, the coenzymes that you need. So when we get to talking about these vitamins, you're going to need to know what precursor they turn into because without them, these enzymes don't work. So here's the big scary list, oh my God, of water-soluble vitamins. And it looks really bad, but it's not that bad, trust me. Okay, so let's make this experience less painful. Starting off with B1, which is thymine. Thymine is a precursor for TPP. What is TPP? As we said up here, it is thymine pyrophosphate. So you're going to need thymine pyrophosphate for the following enzymes: pyruvate dehydrogenase, alpha ketoglutarate, branched chain keto acid dehydrogenase, and transketolase. So how do you remember those enzymes? Well, you can think of it as chips packet. I got this from when I was watching a PAL session last year about this same lecture. Next, deficiencies. Basically, let's start off with what happens when you have a deficiency of vitamin B1. Well, as we said, these enzymes won't work. Now, if you don't have pyruvate dehydrogenase, then you're not going to be able to break down pyruvate. So you can't fully break down glucose. No breakdown of glucose means no glycolysis. And glycolysis helps you with what? It helps you with making ATP. And you're going to first affect the tissues that are highly aerobic. So they depend a lot on glycolysis. Now, what are these deficiencies going to lead to? Well, the first one is beriberi. Beriberi is going to be because of malnutrition. If you have malnutrition, specifically non-enriched rice, by the way, you're going to have a neurological disorder. This is most common in underdeveloped countries. How do you remember beriberi has to do with rice? Well, you can think of it as like very, very small grains of white rice. So they're very, very small grains of white rice. Then you have Wernicke-Korsakoff, which is because of alcohol. What happens is when you drink alcohol, the ethanol is going to interfere with the thymine absorption in the small intestine. And because you can't absorb thymine anymore, you're going to have memory loss and unstable walking. Both of these, as you can see, they have to do with like the brain. Why? Because the brain is a very aerobic tissue. It depends a lot on glycolysis. How would you treat this? You would first of all, you would give them thiamine. Why not glucose first? Well, if you give glucose first, we said that pyruvate dehydrogenase doesn't work. So if you're giving them glucose, they're still not going to be able to utilize it. So first you give them thiamine and then you give them glucose as an IV so that they can actually like their enzymes work and they can metabolize it. The next is B12, riboflavin. Riboflavin is a precursor for FAD and FMN, and you need to know this enzyme, especially. Please know this enzyme. It also is a cofactor for the TLCFN enzymes. This one's more important. How do you remember this vitamin? Well, the best I could come up with was Reba. So Reba from riboflavin is 2, B2 fast for you. So F and F. Okay. Next, what if you have a deficiency of vitamin B2? Well, there's going to be three symptoms you're going to see. You're going to see chylosis, glossitis, and corneal vascularization. Chylosis is basically you have inflammation and like these lesions at the corners of your mouth. Glossitis is magenta colored tongue, and corneal vascularization is you're going to be able to see the tiny capillaries in your eyes. How do you remember these three symptoms and the fact that they have to do with riboflavin? Well, riboflavin, flavin, that part sounds like flavor. So you can think of your mouth and your tongue drooling while you're looking at food. Next up is B3 or niacin. B3, you can remember that 3 for niacin because another word for niacin is nicotinic acid, and nicotinic acid has 3 I's. This vitamin is a precursor for NAD, which is the N of TLCFN. So we're going to see the TLCFN enzymes again here. But also, it's important for G6PD and isocitrate dehydrogenase. Again, know this enzyme. The one we had before for B2 was succinate dehydrogenase. Don't get that confused with isocitrate dehydrogenase. And what do you use the NADH and NADPH for? Well, NADH, as you guys know, is used for ATP, and NADPH is a reducing agent in biosynthetic reactions. Now, this vitamin is needed in relatively higher amounts in the body, so the body is able to synthesize it from tryptophan. Now, this has a deficiency called pellagra. When you have malabsorption of niacin or tryptophan, which was the amino acid, you're going to get pellagra. Pellagra, you can remember its symptoms with the 4Ds. You have dermatitis, which is scaly sores and mucosal changes, dementia, which is memory loss, diarrhea, you guys know this, and death, you guys know what that is. So, toxicity. Wait, but I said that water-soluble vitamins don't have toxicity. Well, in this case, the only case where you would have toxicity is if you give them too much. Normally, we would give vitamin B3 to treat hyperlipidemia. Well, if you give them too much, then you're going to get toxicity, and the symptom for that is facial flushing, as you can see here. B5, pantothenic acid. This one's really easy to remember because panto sounds like penta, and a pentagon has 5 sides. This is a precursor for coenzyme A, which is the C of TLCFN, and it's used for fatty acid synthetase, pyruvate dehydrogenase, and alpha ketoglutarate dehydrogenase. Deficiencies are rare, so you don't got to worry about that one. Okay, B6, pyridoxal phosphate, PLP. Now, this is originally made up of these three like precursors, you could say. Pyridoxine is from plants, pyridoxal is and pyridoxamine are from animals. Why do you need to know these? Well, because they are the main things that turn PLP into PLP. How do you remember that B6 is pyridoxal phosphates? Well, the 6 looks like a flipped P, if you can see what I'm seeing. And these are cofactors in many reactions like amino acid metabolism, but also they're needed for heme synthesis, so gamma aminolevulinic acid, ALA. You need to know this. I should have put it in red, but I forgot. Now, why is ALA important? Well, if you have a deficiency, so you don't have B6 anymore, you're not going to be able to make this aminolevulinic acid. And you need this aminolevulinic acid in order to incorporate iron into heme. So you can't incorporate iron into heme, you get what? Sideroblastic anemia. You guys should pay attention to the anemias that are mentioned in this lecture because there's many different ones of them, and I don't want you guys to get confused. So in this, basically, you're going to see the iron that's accumulating in the RBCs. This blue stuff, that's iron. And that's because the iron isn't being incorporated into the heme, so you'll be able to see it. Isoniazid is an important drug for vitamin B6 because it's very similar in structure to pyridoxine. Where did we discuss pyridoxine? We said that pyridoxine was a precursor for PLP. So, if the body, instead of using pyridoxine to make PLP, it uses this isoniazid, this TB drug that's similar in structure to pyridoxine, to make PLP, it's going to make an inactive version of PLP. So the body is going to get confused and it's going to think, oh, there's a vitamin B6 deficiency, when there is in fact not. So whenever you're giving this TB drug, isoniazid, you have to supplement it with B6. B7 is biotin, okay? Biotin is made by gut microflora and it's involved in ATP-dependent carboxylation reactions like pyruvate carboxylase. If you have a deficiency of biotin, first of all, it's going to be very rare. Why would it happen? Well, if you're eating like 6 raw eggs in a day, you're going to get a deficiency because eggs contain avidin, which is a biotin binding protein. So do not be like this guy and eat or drink 6 raw eggs in a day. And you can remember that biotin has to do with eggs because eggs are biological, biotin. Okay. Next is folate or folic acid. Folate turns into the active form in the body called tetrahydrofolate. This is what we use in the body. Tetrahydrofolate is a coenzyme for one carbon reactions, so basically methylation. And they're really important in making nitrogenous bases. Now, if you have a deficiency of folate, first off, it's going to be more often in pregnant women because they need more folate than normal. So if they're not taking supplements, then they're more likely to have a deficiency in folate. What happens if they have a deficiency in folate? Well, we said that folic acid is needed for nitrogenous bases, right? And DNA is really important when it comes to cells that are proliferating a lot. So if you have a baby, like in the womb, it's going to be growing at like a very, very fast rate. There's going to be so much proliferation. So in that case, if there's no folate, so no DNA, RNA, then you're going to get spina bifida, which is this thing right over here, where you can see it like the spinal neural tube defect, okay? Now, B12 deficiencies can cause B9 deficiencies. We'll get into how when we talk about B12, and they can cause megaloblastic anemia. Again, we'll get into more details about that when we're talking about B12. How do you remember that folic acid is going to be B9? Well, a pregnancy is 9 months long, and you give folic acid supplements to pregnant women. Next is cobalamin. Cobalamin is B12. I really don't have a way for you to remember that cobalamin is B12, but this is what you do need to know. It's used for myelin maintenance, which is myelin is the stuff surrounding the neurons, okay? It's used to make thymidine in DNA. Do not confuse that with thymine, which is B1. Thymidine is like a base that's used for making DNA. And it's also used to metabolize homocysteine. So, what is homocysteine? Is this thing right over here. When do you need B12? Over here, to turn it into methionine. Now, why is this step important? Well, this step simultaneously will replenish the tetrahydrofolate in the body. So it's going to turn 5-methyl tetrahydrofolate into tetrahydrofolate. If there's no B12 or if there's no homocysteine, then this 5-methyl tetrahydrofolate is going to get trapped in the body like this. The body's not going to be able to reuse it for DNA synthesis. So that's going to make it seem like there's a folate or B9 deficiency, when in fact it's all just trapped in this form. B9 and B12 work together. They're like this, okay? And if one is low, you have to check the other one. And where you get B12 from? Animal products. Meat, dairy, eggs, fish, all that stuff. Deficiencies. Again, we have another anemia. The one we talked about before was sideroblastic anemia. Now we're talking about megaloblastic anemia. Let's talk about why it happens. So, you don't have B12. If you don't have B12, you're not going to make thymidine, not thymine, thymidine. No thymidine, then you're going to have you're not going to be able to make your DNA, and that's going to lead to megaloblastic anemia. But how? Well, having no DNA or like a lack of DNA being made is going to affect rapidly dividing cells. And you can see rapidly dividing cells in the bone marrow. So, in the bone marrow, you would then get immature RBCs where they're going to have a larger size and an immature nucleus, like you can see over here. So why is this important? Well, as if the RBC's size isn't right and if it's immature, then it's not going to be able to function properly. So it's going to be like you have anemia. Also, something to keep in mind is that megaloblastic anemia is a type of macrocytic anemia. So you have increased MCV, mean corpuscular volume. I don't know if you guys remember that, but that was in FND. I know, trauma, but it's okay. Moving on. Why would you have a deficiency? Well, you would have a deficiency if you are a vegan. Why? Because we said over here that you get vitamin B12 from animal products. So vegans don't take animal products, but they don't also immediately start showing signs of vitamin B12 deficiency. Why? Well, it's because they have stores in their liver that are enough for them for like 3 to 5 years. Another reason why you would have deficiency is gastric bypass surgery. Before we get into why, what is gastric bypass surgery? In simple terms, think this is the stomach, that's the best I can draw, but you're cutting off like a section of it. So you're losing the cells in this section. What are important cells in the stomach? Parietal cells, because they make intrinsic factor. Why is intrinsic factor important? Intrinsic factor is really important because you need it to absorb B12. They're buddies. B12 can't be absorbed without intrinsic factor. So you take away parietal cells, that means you take away intrinsic factor, that means B12 can't be absorbed. So then you would have deficiency. Then there's also neurological symptoms because of the abnormal myelin. There's more details about that in the notes section of these slides. I don't think it's too important for like with regards to everything else. So if you are interested, you can check out the notes section. Okay, hypersegmented neutrophils are also like something that you see in megaloblastic anemia. Vitamin C. Vitamin C is also known as ascorbic acid. It is an antioxidant. What do antioxidants do? They will decrease the oxidation of LDLs. Now, LDLs are basically low density lipoproteins. There's high density lipoproteins, which are good, low density lipoproteins, which are bad, and then oxidized low density lipoproteins, which are really bad. And it also keeps iron in its reduced state so that it can increase the absorption. But more than that, I want you to focus on the fact that vitamin C plays a key role in collagen synthesis. It is a cofactor for the hydroxylases of proline and lysine. So this step right over here. Why is this important? Why do we care about proline and lysine being hydroxylated? Well, if they aren't, then you're going to have no cross-linking, and without that, your no triple helix shape is going to form. So this normal shape is going to be like all wonky, and that's going to have a variety of different effects. We'll get into that. Ascorbic acid is found in fruits and vegetables. Deficiency. Now, this is probably, in my opinion, the easiest deficiency to remember because it is like lack of it can give you scurvy. I'm pretty sure you guys have heard of scurvy before, but if you haven't, then it's something that's caused by not having enough citrus fruits and green vegetables, or if you smoke cigarettes. They call this a tea and toast diet, and it was most often found in sailors on the sea. Get it? Because sea sounds like sea. They would get scurvy. Their symptoms are because of the bad collagen. They're going to have fragile blood vessels, swollen bleeding gums, perifollicular hemorrhage, bad wound healing, easy bruising, which is also known as ecchymosis. But how do you remember all of this? Well, I want you to visualize Captain Jack Sparrow, okay? He's got like bruises on his face. This is a real life example. He's got swollen bleeding gums. This is a real life example of that. He's got perifollicular hemorrhage, which is basically like like hair follicles around them. There's like tiny spots of hemorrhage. He can lose his teeth. He's got bad wound healing because he has this little scar, and then he has these sunken in eyes. So if you want to think vitamin D deficiency, think Jack Sparrow, and hopefully you'll get to the right answer. With that, we're at our first check-in. How are you guys doing? Do you have any questions for me? I have the chat open over here, so if you want to type it into the chat, you're more than welcome. Yes, question about PLP. Let's go back to PLP. Yes. Aren't the three P's the B6? No, they all will turn into PLP. PLP is B6, but these are just precursors. That's why when you have this drug that's similar to pyridoxine, which is like, think of it as a building block for PLP. If you have a bad building block, you're not going to get like active PLP. You're going to have like an inactive, fake version of it. Does that make sense? What did your slides say? I've been using the same slides.
No, I'm not sure. It just says P6 exists in the three forms and then they are converted into PLP. But I'm not too
Yeah,
sure what they mean.
yeah. These three are converted into PLP, but
Yeah.
they're the building blocks
Okay,
of
thank you.
PLP, so to speak. Okay. Anyone have any other questions? You guys want me to go over anything a second time? No? Okay, because I have questions for you guys now. Be brave, guys. You can answer these. The first one is you're examining a pregnant woman who is, oh, wow, okay. Someone gave the answer. Good job. It's A. Oh, you guys are so smart. Megaloblastic anemia was a keyword. Little meat was a keyword. Um, well, that's great. The answer is vitamin B12A. Question number two. A man comes into the clinic. He has fissures at the corners of his mouth, purplish red tongue, corneal vascularization. I put a picture in there to help you remember. Any ideas? A? Well, see, this is a two-part question. Okay, this is a two-part question, and it's meant to like make you think. These are the types of questions that are kind of going to come on your exam, by the way. Um, Basically, the first thing you need to think of is which vitamin is this? Can someone tell me which vitamin this is? You guys know this. Think flavor, if that helps you. Flavor sounds like what? Yes, riboflavin. Good job. So you have riboflavin. Now, as I said, know the enzymes. Someone was very close. They said B, but it's not B. It's actually D, succinate dehydrogenase. Isocitrate dehydrogenase, if you guys remember, was from the one that causes pellagra, right? It was vitamin. Which vitamin causes pellagra, guys? Think about it. Yes, vitamin B3. If you guys remember the three Spider-Mans pointing at each other, that was the one that has to do with isocitrate dehydrogenase. Okay, so now, if no one has any more questions, let's move on to fat-soluble vitamins. How do you remember the fat-soluble vitamins? Well, if you're an Arabic speaker, you can think of like keda, or if you're an English speaker, you can think of kade. Whatever works for you. Now, the basics of fat soluble vitamins. They are stored in fatty tissues and they're needed in small amounts, and your enterocytes, cells of your intestine, absorb them. Now, if there's a deficiency in fat absorption, so like if there's fat malabsorption, you're going to have Crohn's disease, and that is going to lead to deficiency of all the fat soluble vitamins. Now, these ones, the fat soluble vitamins, are going to have toxicity. if you take too much. Why? Because they aren't excreted in the urine. We said they're stored in the fatty tissues. So if you take too much, it's going to stay in your body and it's going to like cause toxicity. And you'll see signs of hypervitaminosis in the skin, liver, and CNS. Okay, starting with vitamin K. It's also known as phenoquinone, philoquinone. Sorry for my pronunciation if it's wrong. But the pH sounds like F, so F for food. Menaquinone, is an intestinal bacteria, and actually they meet half of the human needs for vitamin K. And so you can think of it like the bacteria are the queens of the intestines. Menadione are from supplements. So that's when you're taking your supplements and it feels like you're dying because you don't want to take your supplements. Dione, dying, quinone, queens, phenylquinone, food. Okay. You need vitamin K for blood clotting and bone health. For blood clotting, it's a cofactor for clotting factors 2, 7, 9, and 10. And warfarin is an antagonist for vitamin K because it stops its recycling. So you can remember that by thinking they're at war with vitamin K. And vitamin K also activates osteocalcin, which is going to bind calcium to the bone matrix. Okay, then you have vitamin E, which is also known as alpha tocopherol. It is an antioxidant. We also discussed another antioxidant in this lecture, and that was vitamin C. So again, it's going to stop free radicals. It's going to protect you from the oxidation of LDLs. It's the least toxic of fat-soluble vitamins, and it's found in vegetable oils. What is an antioxidant? Like, how does it function really quickly? It's going to give an electron to the free radical so that the free radical doesn't steal it from a healthy cell. If you have a deficiency, it's often not going to be because you didn't take enough of it, but it's going to be caused by something called erythrocyte hemolysis, so hemolytic anemia. How would you treat hemolytic anemia? You would give them more vitamin E, okay? And it's more often going to happen in premature infants. Vitamin D, okay, pay attention. Vitamin D, there's a lot of names for its entire process, but you need to know them, okay? Another name for vitamin D is 125 dihydroxycholecalciferol, okay? In the skin, it's known as 7-dihydrocholesterol, and it's inert. It's not the active version. In the diet, you're going to get it from D2 and D3. D2 is inert and it's from plants and fungi. D3 is active and it's from fish, eggs, milk, etc. Both sources, so 7-dihydrocholesterol, this, and vitamin D2 from your diet, are going to turn into cholecalciferol, which is vitamin D3. Vitamin D3. It's going to go into your circulation. By the way, vitamin D acts like a hormone. That's why it's going through the blood, through the blood, through the blood, through the blood. What's going to happen to vitamin D3, to the cholecalciferol? It's going to first go to the liver and it's going to be hydroxylated at the 25 carbon. And you're going to call it calcidiol. Then it's going to go back into the blood. Then it's going to go to the kidney. And you're going to have another hydroxylation at like the 1 carbon. And that's called calcitriol. And this step, this from calcidiol to calcitriol, is regulated by PTH. Also, what does all of this do? It's going to first raise the blood calcium level. So it's going to increase absorption from the kidney, it's going to increase absorption from the small intestine and from the bone. And what's it going to do once it has all of that calcium in the blood? It's going to take it and help with bone mineralization. I know it seems counterintuitive. You have like you're increasing the blood calcium, but then you're also helping with bone mineralization. Think of them as steps. Step number 1, you're raising blood calcium. Step number 2, you're using that calcium for bone mineralization. Okay, if you have deficiency, there's 2 types. There's the one that's happening in children and the one that's happening in adults. In children, because your bones are still forming, The end goal of both of them is to have softer, more pliable bones. In children, because your bones are still forming, you're just going to decrease the amount of mineralization and you're going to have soft bones. In adults, because the bones are already formed, the minerals are already there. What are you going to do? You're going to do demineralization, and that's going to lead to osteoporosis eventually. So in rickets, there's decreased mineralization, and in osteomalacia, there's increased mineralization. Rickets happens in children, osteomalacia happens in adults. Why does it happen? No sunscreen, no sun, no sunscreen, breastfeeding without supplementation, non-fortified milk, dark skin, obesity, all of those. And then we have vitamin A, which is collectively known as the retinoids. There are retinoic acid, and beta carotene. It has to do with the following, all of these things. It is vision, growth, reproduction, which is spermatogenesis, and maintaining your epithelial cells. If it helps you, you can think of it like GREV. You have growth, then reproduction, then and epithelial cells, and then vision. Vision is the most important though. It's the most affected by deficiencies. You get vitamin A from cream, butter, egg yolk, animal liver. These are preformed, or you can get them from vegetables and fruits for carotene. These are precursors. So these ones are like vitamin A already, and these ones need to be turned into vitamin A. So like carotenes. If you have toxicity, that's going to lead to hypervitaminosis A. Then deficiency. Deficiency, as I said, it has a lot to do with vision. So you have the earliest sign, which is night blindness. Night blindness, basically, you can't see in low light. Then you have irreversible damage, which is just a loss in the number of visual cells themselves, and something called xerophthalmia. Xerophthalmia is the pathologic dryness of the eyes. The eyes are just really, really dry. That's a fancy way of saying that. Isoretinol, Roaccutane. This is also another important drug. It is a form of vitamin A, that's used to treat severe nodular acne. And it has side effects like dry skin, dry lips, dry eyes, dry nose. But why is this important? Well, it's important because it is very, very teratogenic. You do not give this to pregnant women, ever. Check-in number 2. How are you guys feeling? Any questions, concerns, ideas you want to share? Anything I should go back to, re-explain? No? Because then we're going to go into questions. Okay. Question number 1. Patient presents with pale skin, sunken eyes, sore gums, muscle pain, loose teeth, corkscrew-shaped hair. A deficiency in what would result in the observed symptoms? And here's a hint. You got a sailor. Water? Yes, yes, good job, guys. Oh my gosh. So this was a trick. I know I put this after the fat soluble section. That was totally 100% something that I had planned to do. I totally planned to trick you guys. It wasn't that I put in the question and then later realized it was for water soluble vitamins. Next question. A woman who had bone problems had decreased calcium levels in the blood. What is the precursor for the vitamin that is deficient? Precursor, not the vitamin itself. Precursor. A. It is. Okay. And this, again, 7-dihydrocholesterol, that's found in the skin. It's found in the skin and it's activated by the UV rays from the sun. Another, you also get it, D2 and D3 from your diet. Yes. And that is all. This was a short one. If you guys want me to go back, re-explain anything, let me know. I tried my best to make this as easy for you guys as possible so you can go back to it right before the exam, watch it again if you need to. So let me know. Yeah, it was fast. Do you guys have any questions though? If you feel like I rushed over something or something was too fast, I can go over it again. Okay, if not, then here's a QR code that you can scan. Thoughts, feedbacks. There's going to be a couple questions on there, I'm pretty sure. And if you have any questions, you guys can contact me here. That is all. Thank you so much.